the right manner. The depth you are supposed to go should not go more than 2 inches in depth. You don't go more than 2 inches in depth. And when you are doing chest compression, please, you have to make sure you allow the chest to always recoil. Because when you are doing it too fast, you will end up shunting the blood. You are not allowing the blood to circulate, the blood that was residual in the person's heart. You were trying to help the person to circulate the blood that was remaining to the brain, to the heart, and to the other vital organ. But when you are doing it too fast, you are shunting the blood. You have to do it in a way that you allow the chest to recoil. Go down once, allow the hand to come back up, and then go back down. Allow it to come back up, go back down. That's how you do chest compression. So that when you are doing it so fast, you end up doing what we call shallow chest compression. Are we following so far? Do we understand anything so far? Okay, very good. So now, another thing we do when we are doing chest compression, like I said earlier, we allow the chest to recoil. Also, we have what we call chest compression fraction, that is minimal interruption when you are doing actual chest compression. Make sure there is a minimal interruption, because when you start chest compression, it is not wise for you to stop. You do chest compression for 2 minutes and then go and take like 3 minutes break. Say, oh, my shoulder, my hip, my waist, my head, my whole body is paining me. No, that's why I said chest compression, you have to actually know how to do chest compression so that you don't worn yourself out. You have to actually know how to do chest compression. That's why minimal interruption is very key. When you start chest compression, make sure you call for somebody else who knows how to do chest compression so that you people can be switching at every interval, maybe every 2 minutes, or as often as you get tired, even before that 2 minutes. Okay, so in that instance, you minimize interruption. When you are tired, you can tell the other person, please come and take over. That person will take over, and then you will also maybe catch a little air. But in between that, switching and all of that should not take you more than 10 seconds. And please, I'm tired, can you take over? You just slide to the side, the other person slide in, and then the chest compression continues. Minimal interruption. That is the best way. That is the best way to do chest compression. And also, another thing, like I said earlier, if you feel a pulse, you don't compress the heart, you only ventilate. As an adult, you give 1 breath every 6 seconds. 1 breath every 6 seconds. How do you ventilate somebody? This is what we call ambu bag. I'm sure a lot of us have seen this before. Ambu bag. Is there any of, well, if you are not seeing it before, it is called ambu bag. Another word for it is bag valve mask. So you can use it to ventilate a patient that is in a cardiac arrest. Now, how do you use this one? How do you use this ambu bag? What we call, you place it on the patient's chin, and then you hold it this way on what we call EC clamp. This is your C, this is your E, and then you place it and make sure it covers the person's chin, from the chin to the top of the nose. Then you hold it tightly, and then you can actually ventilate. When you are ventilating a patient, make sure you don't ventilate with the whole bag, like just pressing the whole bag at once. When you do that, you are actually doing the person more harm than good. You are doing the person more harm. That is, you are giving that person excessive ventilation. You are ventilating that person excessively. What are the side effects of excessive ventilation? When you give the person, at least normal ventilation should be half bag, because this bag contains 1000 cc of air. So at least you give this person half of this bag. That is enough of ventilation. But when you are giving this person the whole bag like this, you are over-ventilating that person. By the time you give the person 2 or 3 bags like this, the person's lungs will be filled up, and you still continue giving that person the air. By the time you know it, the excess air have to go somewhere. The excess air will come back out through the trachea into the esophagus, and then directly into the stomach. Okay. What will happen when you still keep on pumping? The stomach will be inflating and will be like a football. It will swell up like a football. Now, when the stomach swells up, what happens? Where is the stomach located? It's located in the thoracic region. Then you have excessive inflation in the thoracic area. Okay, so we have stomach inflation. We have increased intrathoracic pressure. Increase in the intrathoracic pressure, and when the thoracic pressure is increased, it then displaces the heart to one side. So you now have what they call decreased cardiac output. When the cardiac output is decreased because the venous return is not also enough, you also have what they call decreased venous return. So with the pumping of the stomach, then you have what they call increased chances of that person's vomiting. Increased chances of vomiting and aspiration. And also that person's chances of survival is now next to 0. That's why I said excessive ventilation is even doing that patient more harm than good. So when you are ventilating somebody, you have to ventilate that person appropriately, giving them half a bag. So I'm going to demonstrate to you how you actually compress the heart and then ventilate at the same time. Because some of the time it is only you that is actually there doing the resuscitation. But if you happen to have more people joining you, then all the best. Then you can also share out how you complement each other. One person can be on airway, one person can be on compression, one person can be on defibrillation. Okay, so we can share it out like that. But if you have more people, then you can have more assignment. Now, in BLS, we usually don't involve medication. That's for the advanced life support aspect of it. Now, how do you ventilate this patient while you are doing chest compression? You kneel down by this patient on the side. You place your hand. If you don't have a means of ventilating, you do chest compression continuously at the rate of 100 to 120 chest compression every minute. 100 to 120 chest compressions every minute. But if you have ample bag, a means of ventilating, then you can ventilate 30 chest compression, you give 2 breaths. 30 chest compression, you give 2 breaths. Because people sometimes ask me, if we don't have a means of ventilating this patient, what do? I said just continue chest compression. Do only chest compression, and try to get this patient to the nearest facility as soon as possible. Try to get this patient to the nearest facility as soon as possible. So now I have my ambu bag. I want to do chest compression and give breath. So before you give breath, you have to do what we call head tilt and chin lift. How do you do that? Place your hand on the person's forehead and tilt the head back and lift the chin, because you want the airway to be open. so that you'll be able to deliver bread. If the head is in the normal position and you are trying to deliver bread to this person, it's not going to work out. So the way you do it is you want to compress and give bread. It's called chest compression and giving and ventilating. So you do 30 chest compression, 1, 2, 3, 4, 25, 26, 27, 28, 29, 30. And then you bring your ankle back, place it between the patient's head with your EC clamp, your C, and then your E, till the person's head back and give breath. You can see that the chest will be rising. Okay. And you hold it tight down very well. I don't know if you can see it from here, but the chest is actually rising, if you can see it. So you do 30 chest compression, you give 2 breaths, 30 chest compression, and after every 5 cycles, 30 compression, 2 breaths, 5 times, then you can stop. 5 times is equals to 2 minutes. Then you can stop. Again, check for pulse and breathing. While you're doing that, you want to see if this patient is still in the same condition or the patient's condition has improved, that maybe we only need to support ventilation. If it happens that this patient's condition has improved and you only need to support ventilation, all you need to do is just continue to support ventilation at the rate of 1 breath every 6 seconds. Give 1, 1, 2, 3, 4, 5, 6. 1, 1, 2, 3, 4, 5, 6. 1, 1, 2, 3, 4, 5, 6. Which is for on a 1 minute mark, that is 10 breaths every 1 minute. 1 breath every 6 seconds, 1 breath every 6 seconds will give you 10 breaths every minute. Okay, so that's how you support ventilation. And now, in case the AED is here, what do we do? How do we defibrillate this person? This is the automated external defibrillator. They come in different shapes and sizes. This is the defibrillation part. Okay, so now when the AED comes, what do you do? Normally, the first thing you do again, step number 1 when the AED comes. AED again means automated external defibrillator. You turn it on. That's why it's called automated. When you turn it on, what does it do? It will continue to prompt you. Just follow the instructions. The AED will be telling you, do this, apply pads, don't touch the patient, let me defibrillate the patient, or let me check if this person actually needs to be defibrillated, or if this person has some, what we call some electrical activity. It can be, it's still pulseless, but there is now some electrical activity. This AED is able to do all of that and tell you. So like this AED, let me see. I said when it comes in, first thing you do, you turn it on.
Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
So it's telling you not to place the pad as it is shown.
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
Now I have placed the pad as it is shown. Now I have to connect it.
When the first pad is in place, look carefully at. No one should touch the patient. Analyzing. No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver.
So the AED is also telling us that, yes, this patient needs to shock as soon as
Deliver.
possible.
Shock
So,
now.
so it's telling
Press
you to
the
shock
flashing.
this patient.
Shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
So, if you want this machine to also help you in doing chest compression, counting chest compression, we tell you to press a button, you press it, and press.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
I need to monitor my chest compression. So, at every 30 chest compression, you tell me to
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
chest compression. You can see I'm not using all my body to do chest compression, and I'm still doing chest compression effectively. And I'm following.
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
After 5 cycles of this, it will tell me to stop. Why is checking for?
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Every time you 30 compression happens, that's why it will tell you when you get to 30, it will tell you to stop lifting.
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Chest compression, the 5th one. After the 5th one, which is equals to 2 minutes, it will tell us to stop while he applies again.
Stop CPR. No one should touch the patient. Analyzing.
So it's telling us to stop CPR again.
No one should touch the patient.
Because,
Shock not advised.
okay, so
It is safe to touch the patient.
at least my chest
If
compression
needed, begin
needs some
CPR.
good
For
work.
help with CPR, press the flashing blue button.
So now it's saying that this patient, at least there's some form of electrical activity in the heart. We don't need to shock this patient again. All we can still do chest compression because the full circulation have not come back.
1 minute, 45 seconds until analysis will resume.
So that is how you use AED. It will tell you how to do everything from start to finish until the patient is resuscitated. So now when you tell you to stay clear, there is a purpose for that because this small AED you are looking at, this small machine you are looking at is very powerful. The purpose of using the AED as soon as it gets you or you lay your hands on it is to restore normal heart rhythm. Doing chest compression is to help the heart to circulate the remaining blood. This is the main part of CPR that will quicken the heart again and say, heart, start working again. This AED is the purpose of AED is to restore normal heartbeat. While chest compression is to circulate the heart. Why do we actually need chest compression? Because the brain cannot do without oxygenation for a long time. Mostly like between 5, 6, 7 minutes. That person will, the cells of the brain will start dying off. So that's why you need to do chest compression to be able to circulate the blood around, and also to shock the heart and bring the heart back to life. So it is also my good recommendation. Any facility, because I've been to several facilities, you will ask them, do you have AED machine? They will say, no, we don't have one. Most of the time, the one they even have is the manual one, the bigger one that they usually keep in the emergency room and the ICU, the intensive care unit. That's where but all these things are supposed to even be on every ward. Because the patient will not tell you that I'm about to have a heart attack. Please take me to the emergency room or the ER so that I can have a heart attack over there. So these are some of the minor things that contribute to the losses that we encounter in our different facilities. Just minor things that we can overcome. With all this, I know it's expensive, but it's something we need to have. It's something we need to get. Like I said earlier, knowing CPR is profitable to have. There is no way around it. You have to know your BLS. You have to know how to resuscitate. Even if you don't have the advanced life support or resuscitation, at least have the basic one. That is the way we resuscitate an adult. But is it only adults that have cardiac arrest? No, children also have cardiac arrest.